Now I am going to perform the newborn cardiopulmonary resuscitation. So since this is a newborn, the first thing that we'll have to do is to determine the baby's APGAR score. APGAR is a quick test done at 1 minute and at 5 minutes after birth. The 1 minute would tell us how well the baby tolerated the birthing process, and the APGAR score at 5 minutes would tell us how well the baby is doing outside the mother's womb. Now, for this return demo, let's say that the baby has an APGAR score of 3, which we know falls within the concerning range. This means that the baby is in need for an immediate resuscitation. So, after determining the baby's APGAR score, we'll have to stimulate the baby's response through tapping the baby's shoulder, rubbing the soles of the feet, and calling the baby out loud. Baby, baby, are you okay? Baby, baby, are you okay? So after doing that and the baby still has no response, we'll have to call out code blue or doctor's quick so that the doctor and the nurses could come over and help us revive the baby. So what we'll have to do next is to open the baby's airway. So we'll have to suction the baby's mouth and nose using a suction bulb. We'll have to remove the secretions, if there are any, that is obstructing the baby's airway. After that, we can also do the head tilt and chin lift to still open the baby's airway. And since the baby did not respond to the stimulus we did a while ago, we'll have to perform the positive pressure ventilation. So there are 2 types of positive pressure ventilation, or PPV. It could be through the invasive, which is through the use of a ventilator, or the non-invasive one, which is through the use of a pediatric bag mask. So for this demo, I am going to use a bag mask. So here is my bag mask. What I'm going to do is to cover the baby's mouth and nose with it. Now, hand position would be the thumb and forefinger of one hand will be placed at the rim of the bag mask. Then to ensure pressure seal, and the remaining fingers will be placed in the jawline, on the jawline of the baby. This is done so that our hand is not leaning on the patient's eyes, is not compressing the baby's neck, and is supporting the baby's head. So we'll be delivering oxygen to the baby. Be sure to maintain proper pacing. So what we're going to do is to breathe 2, 3, 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 breathe 2, 3. So PPV should be done for at least 30 seconds or at a rate of 40 to 60 breaths per minute. Now, after doing that, someone will be attaching a heart monitor to the baby and a pulse oximeter to keep track of the baby's heart rhythm, and the pulse oximeter measures the hemoglobin oxygen saturation. This will help us monitor the efficacy of the CPR. So if there is no increase of heart rate after performing the PPV, we'll have to proceed and perform chest compressions and rescue breaths. So how are we going to do chest compressions? So since this is a baby, we can do or use 2 to 3 fingers and locate the lower half of the breastbone of the baby and start the compressions. And we could also do the 2-thumb technique, wherein we are going to encircle the baby's body using our hand, encircle the thoracic area of the baby, and then let the 2 thumbs rest at the center of the baby's chest, and then start doing the compressions. But I am going to do the 2 to 3 finger technique. I am going to begin chest compressions, 30 chest compressions, 2 rescue breaths, and chest compressions would be at a depth of 1 inch only, since the baby's bones isn't strong enough, isn't sturdy enough to handle immense pressure, and we don't want to harm the baby by fracturing the baby's ribs or rib cage. Now, I'll begin doing the chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then give 2 rescue breaths. And then repeat the chest compressions again. So we'll have to continue doing that for at least 4 cycles, and then if still after doing the CPR there's still no increase of heart rate, we'll have to continue doing the CPR and prepare to assist for an intubation. Intubation is where a doctor will insert a tube through the patient's mouth or nose down to the trachea to keep the trachea open and allow air to pass through. Now, if the baby has an increase of heart rate after the compressions and the rescue breathing, then we can proceed to the post-resuscitative care, wherein we could refer to the post-resuscitative care algorithm, because we could find there the procedures and tests that needs to be done to ensure that the baby is doing fine and that the baby's body system are working. So, 2 post-resuscitative care I know is through monitoring the administered oxygen concentration and the arterial oxygen saturation. So after doing everything, doing the procedures, we'll have to proceed to the documentation process, wherein we'll have to input the time it started until the time it ended, and also the response of the baby to the medication and treatment.